Now, as you are talking about this intercostal area, you have got a patient and who is having pleural aspiration to be done. So there is some pleural effusion, yes, and you want pleural aspiration now, yes. Where do you do it? Intercostal space, yeah, intercostal space, but where do you do it? That is what you have to find out. Where should you do it? See, it is a pleural tap being done in the mid-axillary line and the muscle not pierced. In the mid-axillary line, here, yes. Just now we have discussed there was one muscle which was anterior. Remember, transverse abdominis and transversus thoracis is anterior. You are operating here. You mean to say this is the answer because it is on the anterior thoracic wall? Yes. So you are not working there? No. I am working in the mid-axillary line. So which is the first muscle to puncture? This muscle which comes from upper 8 ribs. Who is that? Serratus anterior. After puncturing serratus anterior, external intercostal, interintercostal and innermost intercostal, and then parietal pleura, and then remove the fluid. So you mean to say the first, this is transverse thoracic is the answer? Yeah, because it is anteriorly present and you are operating on the mid-axillary line. Can I see this muscle in some diagram? Yes, you see here. You're looking at the thorax but from the inside of sternum. You're looking at the thorax but from the inside of the sternum. It is on the inner side of sternum. It is attaching to costal cartilages. So it is anterior. You are operating where? Lateral. You cannot approach this muscle because it is more anterior. Okay, then it was helping for forceful expiration. You remember? This is the lady who has come to us with pleural effusion. Yes, this is some pleural effusion now, you see. And you want to remove the pleural fluid here in this bag? Yes, tell me, where do you do it? Mid-axillary line and posterior axillary line also. So it can be done in the post-axillary line? Yes. Mid-axillary line? Yes. Okay. Which muscle you will be puncturing? That is what you have to understand. First is skin. Deep to that is the superficial fascia, and deep to that is this muscle, serratus, and deep to that the 3 intercostal, namely external intercostal, then you have the interintercostal, then you have the innermost. Can I show them in the diagram? Yeah, you see this is the diagram showing. See, this is the serratus anterior first. If you say this is the serratus anterior first, then what is deep to that? What is deep to that? You can see here, this is the external intercostal, then you have the interintercostal, then you have the innermost intercostal. Remember, the neurovascular bundle, which is the intercostal artery vein, the neurovascular bundle is sandwiched between the internal intercostal and innermost intercostal. So this neurovascular bundle is sandwiched between the internal intercostal and innermost intercostal. Yes. I see this intercostal vein, nerve and artery, they are in some costal groove under the rib. Yes, they are in the costal groove under inferior border of each rib, and they are protected there. So this is the intercostal neurovascular bundle in the costal groove. Yes, it is in the costal groove of the rib. And then you have to draw this diagram. So let us draw the diagram now. You are telling this is lungs, and the lungs are covered by pleura. Which pleura? It is the visceral pleura. And what is visceral pleura covered by? The visceral pleura is covered by the parietal pleura. So this is the parietal pleura. What happened? What happened was between the two we have got some fluid. You mean to say pleural effusion? Yeah, pleural effusion, and I want to remove this fluid now. So this is some pleural effusion. Yes. And you want to remove that now. Yes. Okay, then put this needle and remove it. Yeah, that is the point. But when I'm putting the needle, where should I put the needle, and which muscle I am going to puncture is the question. So first of all, you tell that I have to draw the ribs. This is upper rib, and this is upper rib, and then you are looking at the lower rib. So what about the ribs? Actually, there is some vein, and then there is some artery, and then there is some nerve. When goes down is the relation. When goes down is the relation means intercostal vein, intercostal artery, and intercostal nerve. That is the arrangement superior to inferior. So superior to inferior, you have arrangement when goes down is in the costal groove of the rib. Yeah, this is rib, and you can show the structures here also. So who is the most superior? That is the vein. And who is below that? The artery. And who is still below that? The nerve. So you are telling that this is superior to inferior. Yes, it is superior inferior when goes down. And because you have this relation, that's why whenever you are doing pleural aspiration, your needle should be above the rib. Why above the rib? Because if you push it below the rib, then you might damage these neurovascular bundles. You don't want to damage them. Oh, that is why when I do pleural aspiration, it should be the needle passing above the rib. Yes. And not below the rib. No, because you might damage these structures. One other question comes, I will ask you, where do you push the needle? Which part of the intercostal space? The upper part of intercostal space or lower part of intercostal space? If they say intercostal space, then your needle is in the lower part of intercostal space, but above the upper border of the rib. So your needle is in the lower part of intercostal space, but above the rib, superior border of the rib, to avoid injury to neurovascular bundle here. And which muscle did you puncture? Actually, the very first muscle was taking origin from the upper 8 ribs, like 1, 2, 3, 4, 8 ribs. Who is that muscle? That was serratus anterior. You have to puncture that one. And after puncturing serratus anterior, what will I puncture? After that, you have these muscles. You see, there is external intercostal and internal intercostal. So this is some external intercostal and internal intercostal. Yes. And what is the deepermost? Deepermost is here, you will see, and that will be actually the, it is still deeper to the neurovascular bundle. And what will be that? That will be the innermost intercostal. So that will be innermost intercostal. Yes, that is called as the innermost intercostal. You are telling that this is the first muscle to puncture the serratus anterior. Yes. And then external intercostal. Yes. And then the internal intercostal. Yes. And then we have some neurovascular bundle. Yes. And then you have to puncture the internal intercostal. Yes. And then what I have to puncture? After puncturing all these muscles, you have to puncture a fascia. What fascia I have to puncture? That fascia you will find is here, and it is called as endothoracic fascia. So this is some endothoracic fascia. Yes, you have to puncture endothoracic fascia, and then you will puncture the parietal pleura. And after puncturing parietal pleura, you remove the fluid. So first I puncture serratus anterior, then external intercostal, internal intercostal, then it is the innermost intercostal, then endothoracic fascia is fused with parietal pleura actually. And because these two are fused, you can puncture them simultaneously. So you are seeing endothoracic fascia fused with parietal pleura, puncture them, and then I will puncture the visceral pleura. What? You will? No. Don't puncture visceral pleura. Why? Because if you puncture visceral pleura, then air will come here and it will become hydropneumothorax. You want hydropneumothorax? No, don't puncture visceral pleura. You have to puncture only parietal pleura and aspirate the fluid. If you are puncturing the visceral pleura, you puncture the lung. Air come here. And when the air come here, it will become hydropneumothorax. Why are you complicating the picture? Don't touch the visceral pleura. Is already a question. Okay, intercostal drainage. What about the intercostal block? What intercostal block? What is happening now? See, you are telling that you are puncturing some external intercostal, intercostal, and then you are removing the fluid, fine. But what about the intercostal block? If you are talking about the intercostal block, maybe multiple rib fracture. If there is multiple rib fracture, then it will be quite painful, and then you'll have to block the nerves, intercostal nerves, Remember one thing, which we have not discussed yet. Maybe the neurovascular bundle is running in the costal groove at the inferior border of the rib. It also gives some collateral branches, and those collateral branches are running. Maybe they are small branches, maybe, but they are running at the superior border of the rib. Oh, then how was I doing pleural aspiration? You are doing pleural aspiration, of course, above the first rib, but be aware that maybe it is small branches, but there are neurovascular bundle above the rib also, and they might be compromised when you do pleural aspiration. Be careful. They can be here also, though it is understood that we have to do pleural aspiration above the rib because the major bundle is below the rib. So major bundle is below the rib. Cannot push the needle below the rib? No, for pleural aspiration. So I push it above the rib, yes, and I might damage collateral branches. Yeah, you might. But it is done above the rib, yes. And where is the block given? Block is obviously given below the rib. Now it is an expert, some anesthesia expert has come and he knows where are the bundles, and that is why he will escape injury to the nerve but block it here and block it there. So you mean to say intercostal block when there are multiple rib fractures, then I give the block below the rib first? Yes, but you have to give it above the rib also. Why above the rib also? Because maybe there are small branches, but they can also be carrying the pain, so you have to block them also. What if somebody asks me, where do I give the intercostal block? What is my first answer? Of course, the first answer is below the rib because that is a major nerve you are blocking, intercostal nerve. Okay, so intercostal block is given below the rib. Yes. And intercostal drainage is done above the rib. Yes.